Thank you, Mr. Chairman. I've got a variety of subjects to talk about. 16 years ago, this whole malaise that encompasses the healthcare part of our economy. I was sick and tired of hearing how lucky I was that my costs are only going up 5 to 10% a year. I had a business that had nearly 300 employees then. For 17 years prior, probably had 20 to 25. It was a much smaller part of our GDP. Didn't have to worry much about it. But to really get a grip on it, I was large enough to self-insure, which they didn't tell me the year before because they were making so much on the prior plan. And then I poured everything in the kitchen sink at prevention and wellness, and then did what it took then to create healthcare consumers out of my employees. You know what happened? We've not had a premium increase for my employees in over 15 years. That's unheard of, but it was so simple to do. So my first question is going to be on a particular part of healthcare reform that involves hospitals. And I'm going to start with Ms. Graybert, site-neutral pricing. You know what that is. You know how the big hospital chains end up buying all these other places, all of a sudden jack up the costs based on overhead factors. This is very simple here. What is that doing in our healthcare costs when they buy places that were doing it for less money and for no reason end up jacking up the prices and keep the competitive prices that were in place, all of a sudden they're gone? And explain what site neutral is to people out there that may not understand it clearly.
Thank you for the question, Senator Braun. I'm a big fan of your SITE Act. It's a bipartisan bill that's been introduced in the Senate, and it targets a payment peculiarity within fee-for-service Medicare. I call it a peculiarity, where outpatient offices receive what's called the facility fee for the services they provide. The same service could be provided in an independent primary care office, and they do not receive the facility fee. So there's a discrepancy in the reimbursement rates that Medicare pays, and it hurts the competition. It incentivizes things like consolidation, which are not good for the healthcare system, and it costs Medicare beneficiaries more. Medicare beneficiaries pay a percentage of cost sharing for every service that they have. If a facility fee is something that they're exposed to, they pay more out of pocket every time they go to that outpatient facility versus an alternative like the physician office. So it's not good for the healthcare system, it's not good for competition, and it's not good for Medicare beneficiaries.
Well put. And with all that, I've got a Democratic sponsor, Senator Hassan, and Senator Kennedy on my side. Every senator ought to be on that if we're wanting to lower costs.
I agree. I think every senator should be on that bill.
Okay, I knew you would. Dr. Taylor, when it comes to healthcare transparency and competition, which was a hallmark of what I did, got another bill out there that was introduced, believe it or not, with me and Chairman Sanders of the Health, Education, Labor, and Pensions Committee, with the simple idea that if we are going to bring costs down for the government or through the private pay plans, we've got to have information that everyone can see to make an educated decision on what kind of health care they want. What do you think for hospitals and insurers? Is it going to be wise to have them list, in not a cryptic form, prices of everything they're doing, even some of the agreements they make between themselves that try to cloak all of it to keep us from being healthcare consumers?
Thanks, Senator Braun. Appreciate the opportunity here. First of all, I guess I would applaud your shining a light on the need for cost transparency. The first thing I think we do is we start with our medical students and our residents in training and teach them about cost of care. It's often not even part of our training to understand cost, even as physicians. So one of the things you've heard throughout testimony today is we've each talked about the importance of there being either a physician-led something, physician-led ACO, physician-led organization. So you need to bring providers to the center of the organization and expect us to pay attention to cost. And when you have a physician-led ACO or organization, then you're putting that in the driver's seat there. So it helps when we all know that we are supposed to be caring about cost. And then on the transparency side, I'll use your site neutrality as a perfect example. Most people, general population laypersons are not aware that getting their screening colonoscopy in an outpatient center would be a different cost than doing it in a hospital. It's not quite as simple as just listing the costs.
Right.
But they should be aware that there is a cost difference, and then they should be educated to ask, is there a reason that I need to get this at a higher cost site of service?
One of the other things we did was a free biometric screening, and it was one of the best investments I ever made. Dr. Rauner, would you want to briefly weigh in on this topic as well?
Yeah, I tell people my single biggest surprise taking on this role is I knew there was price variation. I always thought it was like 20, 30%. In Lincoln, Nebraska, it's tenfold. And one of our biggest challenges was figuring it out, actually. And so, although it took us a while in Medicare, we actually saved money pretty quickly with our commercial plan because we figured it out. But we didn't do it with information they gave us. We did it with information on our own EOBs for our own family members because they have to tell us what they asked us to pay. And so we quickly realized, for example, on my own EOBs and other colleagues, we started looking, okay, well, how much, it was $1,800 to $8,000 for a colonoscopy, depending where you went. Same gastroenterologist, same scopes, same meds, it's simply the site. Lab was a tenfold difference. So if you could figure that out, and what consumer wouldn't want to figure that out, the problem is we found that the insurance companies often had gag clauses where they couldn't share the information with us. So we had to find creative ways to figure that out. But boy, you could save a lot of money. And the biometrics are huge. There's employee wellness done right, and there's employee wellness done wrong. So I congratulate for going the biometric route. That's really how you have to do it.
Thank you so much. Prevention, wellness, competition, transparency.
Yep.
Everybody else lives with competition and transparency. Healthcare industry ought to as well.
Amen.
Thank you.